I'm at work and
Dear Heavenly Father, help us to make the right decisions for the people of Corona County. Amen. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Roll call, please.
Brumman. Here. Brady.
Here.
Small.
Here.
Thompson.
Here.
Here.
Accept the motion to approve minutes from October 6th. Support. Moved by Terry, supported by Bill. Any further comment? All those in favor? Aye. Those opposed? Motion carries. Moving on to public comment. Public comment limited to 3 minutes per person. Please identify your name and your township.
One person coming.
Anybody? Texting in? Okay, no public comment today. Last chance. Okay, thank you, everybody. Moving on to presentations, Jennifer Martin, 44 North Benefit Consultant. Health insurance renewal. Is she logged in? Doesn't look like it. And I maybe have to come back different. It's gonna be tricky. All right, we'll see if she shows up. All right, into business then. Okay, I'll make a motion to approve pre-authorized claims and open claims presented for payment between October 6th, 2021 and October 19th, 2021 for check numbers 145650 to 145788 and e-check numbers 1674 to 1689 for a grand total of $3,463,710.14. For Brady, seconded by Small. Comment? Yes, certainly.
The one check that was written to the state of Michigan for the state education tax that was collected by the townships was $2,859,000. So if that puts in perspective.
I think that's the most money I ever put my name on. Ever. Okay, with no further discussion, roll call, please.
Thompson.
Yes.
Small.
Yes.
Brumman. Yes. Brady.
Yes. We keep an eye out for Jennifer. Next up, Board of Canvassers appointments. Stephanie, would you like to?
Oh. You're moving too fast.
Yeah, I know.
The law requires that it's done by a ballot, not a secret ballot, so your names are on those. And then once your vote is cast for the canvasser, there are 4, 2 Republicans, 2 Democrats. Their seats are staggered. So I pre-filled in the names that were submitted by both chairs of those parties. And then once that's collected, I can just be on the record and announce who was appointed for the new expiring seats.
So we just have to make her do it right now.
Yes,
You don't need a motion.
you can make a motion. No, this is just a pass of the ballot. Yep, that's what I thought. No, I actually put your name right on there. Yeah, right. I just wanted. Thank you. For the Republican Party, Jamie Germond is the one that was going to expire, and Ted Fine for the Democratic Party. And of those, Jamie selected for the Republican. And Ted Fine is for the Democratic Party. Same for this one. same to reappoint for this one as well. And this one as well. That's the unanimous vote for the two to be reappointed. And then I believe 5 days to notify them, so I'll send them out a letter tomorrow. And I'll let the chairs both know as well.
Okay, thank you very much. Next item on new business, Algonah Township Soil Erosion Permit Fee Waiver Request. So, Dan's not here to speak about this, but, well, first of all, I'll make a motion to accept the fee waiver request
Is that,
for,
I'll support the discussion. Is that the total amount or is there going to be a small registration?
We've been thinking about it, profit organizations throughout the county, when they go to a project that required health permits or building permit or whatever, that we waive the permit fee, but we have a filing fee of $30 or $35 just to get them into the system, so that when they run through the inspections, which we're still required, it brings it up in the right sequence. That would be a different motion, but it would be something that the whole, everyone could get benefit as a nonprofit project.
we file that as a policy.
I believe so. Nonprofits and government.
I thought it was voted on years ago to be on a case by case
I thought
basis.
It was a case by case, true, but what we're looking at now is more of a blanket.
This would be just, hey, you walk in, you're nonprofit.
How much is the registration fee?
35, I think.
Well, for a building, it's 35 and it's not really, it's a preliminary. But I have
But
no,
this is a soil,
yeah, this is a little different, but I have no problem with dropping that to 10 or 20. In many cases, I know individuals have picked up that $35 and paid for it, so the entity never did have any cost. I'm aware of 3 or 4 cases such as that. And I'm sure there were others. I expect there were others. Perhaps, Chairman, if we would just to pass the motion that's on the table and then perhaps have a formal motion that would be inclusive of what Commissioner Thompson recommended.
I think to approve the waiving soil erosion fees for the soil erosion permit fee waiver. Approve waiving the fees for the soil erosion permit. Stick to that and then do another motion for identifying the filing. Okay. Well, that's my motion. Approve the waiver of fees for the project at Black River Park. Second by Terry. Do you want to? Second by Bill.
One of us will be happy to.
Motion by Adams, second by Bill. Any further discussion? Besides, we'll vote on a motion for the filing fees, right? At the next meeting, once we determine what that's going to be.
Yep.
Excellent. No further discussion, all those, well, it's money. Roll call, please.
Small,
Yes.
Drummond,
Yes,
Thompson,
Yes.
Brady.
Yes.
And Carolyn, you asked if that needed to be done by a motion, and it says it just has to be done by the submitted names and the use of ballots, but maybe just to cover it, you could do a motion, perhaps. That's right there. Yep.
Okay, next item.
we could back.
Oh, sir.
Request.
Okay,
I would move to fill the 2 vacancies on the county campus board with the Republican as Jane Germond and the Democratic position as for Ted Fines, as voted on by the Board of Commissioners.
motion by Carolyn, second by Terry. Any further discussion? Let's have a roll call.
Brady,
Yes,
Brumman,
Yes,
Small,
Yes.
Thompson.
Yes.
motion carries. Next up, fiscal year 2022 contract, Michigan Drug Court grant. Jennifer has agreed to come down and give us the
Yeah, I know. On September 28th, the court received notification from the Michigan Supreme Court that we have been awarded a Michigan Drug Court Grant Program award for $56,500. State Court Administrative Office for our operating expenses for the next fiscal year. In order to implement that grant, we would need the board to authorize chairman to accept the grant and so we can go ahead and file budget amendment. So basically asking the board this time if they would give Mr. Brady authorization to sign the grant, accept the grant.
approve and authorize chair to sign.
motion by Drummond. Second by Bill. Any further discussion?
In reading in the packet that had this on it, one of the items was the timely submission of request for payment. Have those all always gone in on as the regular?
This grant, absolutely, yes, yes. We have to have those in by the 10th of each quarter.
They're
They're
supposed to
supposed
be.
to be. They send us lots of email reminders. So
Thank you.
Further questions? Hearing none, roll call please.
Thompson,
Yes.
Brumman,
Yes,
Small,
Yes.
Brady.
Yes.
Okay.
Thank you. Next up, fiscal year 2022 MSU extension agreement for extension services. I should have had.
Jennifer Martin is present.
Oh.
Oh, that'd be great. Is she?
See a cop line.
The only one with picture.
Oh, so we can get back to the. Okay, well, let's approve this real quick first.
Motion to approve the contract agreement between extension and
We didn't mean to approve this. Let's decide on this real quick. Sorry, my bad.
support.
Moved by Bill, supported by Carolyn. Any other discussion?
Is this a raise or anything?
We got a packet.
I believe it's the same as your previous.
All right, no further comments. Let's roll call this one.
Brady,
Yes.
Brumman,
Yes,
Small,
Yes.
Thompson.
Yes.
Okay, I see Jennifer is present. We can go back to our 44 North presentation. You want to chime in, Jennifer, when you're ready?
I can do that. Sounds good. You guys are zooming through your meeting. I was 4 minutes late, so you guys, I think we're moving along pretty quick. How is everybody?
Very good.
Awesome. It looks like you guys do have the agenda. That one I just sent over to Trina today. It looks like I see that in a couple of your hands. So I'm gonna kind of follow along with that. Just, it kind of keeps me on track and it bullets out and summarizes a lot of the various spreadsheets that I hand out. So we are this year facing an increase. And if you kind of scroll over to page 2 at the top, January 2022 renewal, you're going to see the 2 different plans. So the HSA plan, which is where we've got the bulk of the membership now, we've got 42 enrolled, is receiving a 12.2% increase. And then the HRA, we're down to 7 contracts. So last year I looked, we had 11, and now we're down to 7. So I think we've dropped some employees since then, and probably, I don't think this even includes the sheriff's department. So we're going to be down even more because this was developed prior, I think prior to that happening. So there's 7 contracts in there and we're receiving a 9.8% increase. So both are going up. We do have some pretty large claims that I skimmed past on page 1, which is the rate development. And so it's kind of the box I look at when going through your entire renewal, which is pretty lengthy. This is the piece that I look at to see, okay, what is the premium that you guys paid in comparison to the claims that were paid, to see if the increase that you guys are receiving is justified. And it is. And if you see below that, there's large claims, any claims that are above 75,000. We've actually have we have more than we probably have ever had. So I think that that's probably why we're seeing such an increase this year, is just because we've had just a really bad year in utilization, unfortunately. So the good news is I was looking at, and I guess depending on how you want to look at this, but I was looking at all of last year's financials because I like to see, okay, what did we project for a renewal cost last year, and what are we showing it as the combined current cost this year? How close were we on that projection? And if you recall, last year we were projecting initially it was almost $650,000 in spend. And then we had made 2 plan changes. So we were able to reduce the cost on both plans by moving over to something a little different, but still giving the employees the same benefit. And that was about a $20,000 savings altogether. Between that and then having some less of a membership on the plan, our combined cost currently is about $560,000. So that is good news that our cost is actually down compared to what we were looking at last year. It's even down below what the renewal cost was last year. But end of the day, the cost is still going up. It's just those projections are a little bit different. And I'm not sure, how you guys do your books, but it is something that I did want to point out. Before I'm going to keep going, but you guys stop me as you have questions. And before I do, I think I will just stop for a second. Do you guys have any questions so far?
I do, Jennifer, on the middle of the second page. Renewal breakdown by division.
Yes.
ERAD division.
Yep. So Trina actually already questioned this, and it confused me too. So we talked to Priority Health, and that because that division is still open, they had to put a contract in there so it could develop a percent change, but nobody is in it. So the 4 that they're showing is actually the pre-65 retirees. They're in the HSA. But we don't, it's more there for if somebody did want to go into it, it is still there. But we're going to close that out this year.
Is that going to affect one? Okay. Thank you.
You're welcome. So when you look below that and you see with the green header, that last box of HMO traditional 5,000, you pretty much can cross those rates out because they're not going to apply. We don't have anybody that's in that division. And we're going to close that out this year. So that's just kind of stemming from the old pre-65 retiree plan that we had in place. So I think let's go ahead. Let's flip now over to the spreadsheet. Let me just really quick pull it up on my end here. I apologize. Hang on one second. Thought I had it up. All right, we'll just use the Excel version on my end. Okay, so on the spreadsheet that you guys have, a lot of numbers here for sure. And basically what this is doing is it's breaking out all of the various costs. So if we start from the very top, we have these 3 boxes. Do you guys have a color? Do you guys have it in color?
Yes.
Okay, perfect. I'll reference colors then once in a while because it makes it a little bit easier. So the first 2 boxes that says current and reimbursed, that is your HRA plan. So that's the plan that the bulk of the employees were in 2 years ago that we're slowly seeing them move over into the HSA plan. So we've got right now 7 enrolled, and it might even be less because like I said, this count was taken prior to some of what with the sheriff's department and those coming off too. So we might even be down even more. So we're buying that $5,000 deductible. And the employees, they're getting a $2,000 deductible. So that difference where that savings comes in is what we're paying to reimburse those claims. So it's something that we're always tracking because we don't ever want to exceed the actual savings that we're receiving. Now with you guys, because this particular group has become so small, we're starting to see where the spread is becoming less and less. And so we're not losing money, but potentially we could come to a point to where we are going to either it's going to be about a wash or we're going to offset some of that savings just because there's not enough people in it to be able to outweigh the risk that's coming in, if that makes sense. So something just to keep in mind, and we can circle back on talking about that in a minute. So underneath that, you're going to see several sets of rates. The first 2 boxes where it says current monthly and renewal monthly, that is the carrier rate. So that is Priority Health saying, okay, today we're charging you $402.39 for a single. Effective January 1, your rate is going to $441.62 for a single. And you'll see that 9.75% increase right below it. That's the carrier increase. To the right of that in the gray, you're going to see current illustrative and renewal illustrative HRA rates. Since the employees, they're not getting a $5,000 deductible, they're getting a $2,000 deductible. We have to come up with an illustrative rate to determine a premium cost for a $2,000 deductible type plan. And that portion is based on that group's utilization. So if it's performing really well, you're getting a $2,000 deductible plan for much cheaper than what you would buy without doing an HRA. So last year, we took a huge hit to this HRA rate because that was the year that we had everybody jump off over to the HSA. So it's going down, it's starting to level itself back out a little bit, but it's not down a ton. That's going down about 8% this year. That will help offset some of that 9.75% increase. If you go further down, you're going to see kind of like a green celery type color. And under single, you'll see a rate of $464.50 for current and $498.91 for renewal under single. Does everybody see that? So kind of below that big purple bar now. So what that is that is combining the 2 numbers above. That's saying, okay, this is now the illustrative rate. We can't determine COBRA rates. We can't determine employees' cost share off of that $441 from the carrier because that's a $500 or $5,000 deductible plan. So we're going to determine our cost shares off of this $498.91. So that is your overall renewal illustrative rate for this particular plan. So when you combine it all together, you're looking at an approximately about a 7.4% increase from where they're currently at. And then if you go further down and look, we calculated right now the employees, and this is in the orange, they're paying a 15% cost share. So if they want this plan today as a single, they're paying $69.68. If we made no changes to the plan and we continued with that 15% cost share, they would be paying $74.84, which is simply 15% of that $498 above. Slightly above that, you'll also see where we always calculate out the PA 152 caps. You guys have the option every year to either opt in or opt out. So you'll want to do a board motion as far as which you want to do. If you opt in, you can do hard cap or you can do the 80-20. If you did hard cap, this plan actually falls below the state hard cap, which you'll see to the left, a box that says 2022 PA 152 calculation. So for a single, it's 7,304. What that means is if you opt in and elect the hard cap, the most that you can pay is 7,304. Anything above that turns into the employee's cost share. You can see here, this actually falls below, so it would be a free plan. You also, if you didn't want to do hard cap, you could do the 80-20. And that's, 20% of that cost. And an employee for this particular plan, it would be $99.78. Or you can opt out, which is what we've historically have done here. And we have come up with kind of our own cost share, which I think the goal was always to be kind of almost a hybrid of the middle of what you see above. Any questions on this plan before I go into the HSA?
Jennifer, I just have a question.
Okay.
That renewal illustrative cost, is that more of what is that more of what we should look at is the renewal cost that we're going to see on the actual bill?
So what you're going to see on an actual bill will be above under the priority logo that says 441.62. Right now, you should be seeing 402. You're going to see 441.62. The other number is the dollars that you get billed for the HRA. So I don't know how they do that with you. Priority, is it on your monthly bill or do they do that weekly, bi-weekly for the utilization?
It's weekly.
Okay.
Works for the utilization of the HRAs, yes.
Yep. So that's where that other gray box is coming from. That's where you'll see that. Obviously, those are illustrative rates, so you're not going to ever see 57.29. But what at the end of the year, the goal is to come in pretty darn close to that $9,000 that we're allotting to reimburse back in claims. To the right of this, the far right blue box, you're going to see the HSA plan. So this is where we've got the bulk of the membership. The nice thing with the HSA is this one does have it's more of a fixed number. So the HRA has that variable where utilization runs a little different year after year. As a large group, there's typically some pretty significant savings, but we're starting to kind of to close that gap there on ours. So with the HSA, we're buying a $2,000 deductible or a $4,000 deductible if they're enrolled as a two-person or a family. And then they've got that 20% coinsurance after it that goes up to the out-of-pocket max of $3,000 or 6,000. So the deductible goes towards that out-of-pocket max that you see further down in the blue. This one, the current rate for single is 378 with priority, and it's going to 424. So this one is getting a 12.24% increase. Again, my guess is it's because we're starting to level out with now this being more the main plan where it was not before. I suspect next year, unless we've got some, pretty large claims come in again, otherwise I suspect this one to start to kind of taper off, and we'll see a much better renewal next year. Further down, what we did is, because again, especially with PA 152 and with COBRA, whenever we do those calculations, we have to include any employer contributions into that number. And so we want to come up with an illustrative rate here as well that includes the dollars that you're contributing. So right now you're contributing for anyone enrolled as a single, $1,000, and anyone enrolled as a 2-person or a family, $2,000. And then that is paid semi-annually. So they get half of it at the beginning of the year, and then they get the other half middle year. And so then when we're calculating out those costs, we're looking at it based off of a 508.11 premium for a single. And that's really, again, more for COBRA purposes here. This has been the free plan that we established. And I did put in here, just so you guys could see what it would look like. I did put in what a 15% cost share would look like too. So the premium between the two, if you compare the two illustrative costs, are becoming very, very close. So, and I know when we initially did this, when we set it up, the goal was to set it up so they were built very close, to where one was not really creating a much larger cost than the other. So at this point, it may make sense to start to either combine these plans and only offer one, or put a much bigger spread of coverage to create a bigger spread of the rates between the two. So if you look further over to the left, you're going to see a box that says combined current cost, $560,000. And the combined renewal cost is $616,000. So overall, altogether, we're looking at an approximately about a 10% increase. So about $56,000 is what we're looking at if we were to renew as is and not make any changes. So one idea just with having an increase like that is, maybe that plan is not free anymore and there's a small cost share to help offset some of that $56,000. That's just one idea. So I do have several quotes out there with other carriers. I'm looking at BCN again. I want to see how their rates come in. So there might be another option. For now, this is all I have. So I wanted to at least give you guys this update so you were aware of kind of what we're facing at the moment. But know that, I am quoting this out. I'm looking for other options, and hopefully I'll have a solution to say, okay, we can, move to a different carrier and have the same type of plan design in place, but yet not have to incur an additional $50,000 in costs. So that would be my goal, is to continue to have a free plan and try to figure out how I can wipe that dollar amount out. I just have to wait for those quotes to come in.
Okay. Is there any worthwhile tweaks we could do to the HSA plan to try to negate that $56,000 increase?
Mm-hmm. Yep. So I'll be looking at that too. I'll be looking within the priority menu. They do have a new level funded type of a plan that I'm looking at as well. So there's some different things. First and foremost, if there's something I can do within the same carrier, that's what I would prefer to do. If it's not going to, really reduce coverage. I think we got lucky last year and we're able to make, some very minor changes to the plan to offset most of that increase that we were receiving. So who knows if we can do that again this year, but that's what I would like to do. I'm waiting for those numbers to come in. I'm hoping I should have something here in the next week. And so 2 weeks at the most. I'm not sure when your guys' next board meeting is, but I figured for that one, I'd like to come in person. It's a little bit easier once we start looking at options. Obviously, if you guys can make that call with COVID and what's going on at that time, but if you guys want to give me a date for that next one, we can try to keep this thing going.
Fourth, I think.
I can't see.
You have November 3rd on the agenda.
Third, you're right.
November 3rd.
It would be our next board meeting.
Okay. Okay, I'll look at my calendar and hopefully it'll work, or I'm in a position where I can switch some things around, which that should give me plenty of time. And if I do get stuff back much sooner than that, I'll probably send an email so you guys can start processing and looking at some of it in advance. I'll try to just continue, like I said, to keep this flowing as quickly as I can.
And maybe what we can do is do a morning, start earlier that day, do a morning workshop, insurance workshop. And have some more time to talk it out instead of doing regular business. I think that would be beneficial, guys. So maybe on that day, we start at like 10 o'clock, like we used to. Call it a insurance workshop. I don't know what you want to call it, but give us some extra time to talk with you about it, if that's all right, Jennifer.
Yeah, that's fine. I don't know that I want to go earlier than 10. I do like, I like my sleep a little bit. I'm about 4 hours away, so, but 10 is perfect. I think that's usually what I typically came at before, so.
I just think this bears some extra time.
Absolutely, and if you guys are able to give it to me, I will take it for sure, because it does. And when I'm looking at options, I want you guys to have that time to ask questions and really understand, especially if it is a different carrier that I'm focusing in on. But hopefully prior, I can kind of have an idea of where I'm leaning to get some information out to you guys in advance. That way you can look at, doctors or what have you. So that will be my goal, but we can plan on the 3rd at 10 a.m. Real quickly, so on the agenda, I did also include on the 3rd page, the ancillary renewal. So good news there. Those are all renewing at a 0%. So there's really not a lot of attention needed on the Delta Dental, the VSP, or the Lincoln. So Lincoln renewed at a 0%, and then they put us at another 2-year rate renewal. So we're not going to renew on that one till 2024, which is good news, and Delta till 2023. So even next year on all 3 of these will be at a 0%. So not a lot going on there. I did include, some other quotes that I am looking at. We're looking at, in addition to that, the Blue Cross, the BCN, and within the priority health menu as well. And then lastly, something that I will just kind of touch on, and maybe when I come, I can bring some additional information when you guys have that extra time. And really it's more for administration, but I am looking at rolling out for you guys the B-Swift. So I know I've talked about it in the past, and we've had a cost that was associated with it. And we're at a point now where we're trying to just roll all of our groups out onto it, even if there's not a cost to it, because it helps with some of those enrollments that are coming through our office to automate it. So the more we can automate, the less it is for errors. And I think for you guys, you'll really like it. So it's a way that we'll be able to do open enrollment electronically. So employees won't have to, fill out any type of paper. And it allows you guys to be able to put any notices or anything really that, they need to see on an annual basis out there, and get an electronic signature on that as well. So more to come on that. It's not anything that will be ready for this year because it is pretty time consuming for our team to build that out. But I have put you guys on the list to start having that built out for the beginning to mid 2022. So that way it's ready for that 2023 open enrollment period. And then I did include, there are some updates on the HSA limits. So those are out. Those are bulleted on here as well, about $150 extra. The employees see on a single there, or I'm sorry, $50 extra, and 100 the employees will see there depending upon how they're enrolled. And then on the last page, there are some upcoming webinars. So one's actually tomorrow, more around FMLA. So this does have some hyperlinks in it if you get it via email. I don't know if you noticed that or not, Trina. And if you can't get those, let me know and I can send them to you. But if any of these you guys are interested in, you're more than welcome to participate. And then Blue Cross, they've got some pretty good ones coming up too. And these ones employees can actually even join. So you're welcome to send these out and I can send it into a different email to you as well. So that way you can forward it on.
Jennifer, it did not work in that email you sent. So if you do want to send me a send it out.
And Jen, do I see that we're not going to be utilizing task any longer through with
So
Cobra?
that was, thank you. I must have skipped right past that. So that is the other thing. So I've been talking to Priority Health and assuming that that is where we're going to stay for the year. So I want to wait for those quotes to come in and get a game plan together. Assuming we're staying with Priority Health, I really would like to move over to their iSolved plan, which I don't know if you've ever heard of Infinisource, but they merged. So now they're called iSolved. And they will actually, as a Priority Health client, they will administer your Cobra for free. So right now you guys are paying $1.15 per employee per month, which is pretty standard, but I know there's been a lot of problems with task and we've had our fair share of problems as well, trying to get, some of those problems resolved. So I figured this would be a good time to make that transition. And it'll save a little bit of money as well.
Carolyn, you had a question?
I do a couple of questions. Jennifer, a couple of things on the papers regarding the COVID. What impact, if any, did that have on healthcare as far as Alcona County was concerned?
Mm-hmm. So good question. And you know what? I was going to actually fill that out a little bit more and I did not. Let me just pull up your renewal really quick. Bear with me here. Or actually, I think did I send the report to you guys?
I have about 4 or 5 pages on it.
Perfect. Okay. Then I moved it over into my calendar. And pull it up there. I did not move it over. Okay. 1 second. So we are starting to see that taper off as far as the impact that it has had. And it is more of it's been kind of broken out into 2 different years. So there's not one year that is getting hit significantly with all of those additional costs. So there is some factor that does play a role for sure as it relates to your renewals. So I'm pulling this up right now. So this is going to show us basically all of your members that have been tested. It's going to show us those that have tested positive. So you can see up at the top of that report, there's some color-coded boxes. So there's kind of like this swampy color green that says members, and then this darker green that says claims. So you can see based upon how that physician billed those claims that they fell into a COVID type test or a COVID type diagnosis. So it looks like you guys had 4 members that tested positive, but you had 11 COVID claims. So it could be they just billed it funky versus an actual diagnosis, or it was a suspected COVID. So the physician felt, very firmly that it was COVID before the test even came back. To the right, you're going to see the test and the dollars. So the test is at 4,000 in claims. And then to the right of that, you'll see in dollars for just COVID expenses altogether. So that's going to be if anybody was hospitalized, and I think we may have had one. So that's where we're seeing kind of an uptick of some of these dollars.
We've heard time and time again that there was no cost for the vaccine. But
Yeah,
yet
it's unfortunate that they continue to say that there's, it's free, because it was almost a year where the testing was free. It's not free. It's, there are federal dollars that are applying to help offset some of this cost. But at the end of the day, that cost is costing the employer group. So it might be free to the member, but it's not free to the group.
we ultimately
Yeah.
have to-
Yep. It's especially, you guys had some inpatient claims. So there was 6 inpatient claims totaling around that $60,000. Doesn't mean it was 6 different people. It shows 6 members, but it could be different incidents of the same member. But I mean, you guys must have had a pretty bad time at some point. It looks like more from like January to May of this year, where you guys were seeing some spikes, especially in your testing. Oh, the third page gives you a little bit more of an easier breakdown. So this is where it shows you have 53 tested, 11 of them were COVID positive, and 6 of those 11 turned into inpatient claims. So that means, they were tested, they tested positive, and then either they were already in the hospital or they ended up getting admitted into the hospital after the fact, 24 hours, 48 hours later.
What method
And then, what's that?
method did Priority use to obtain the information as far as anyone who received their vaccines outside of our medical provisions?
Yep. So, and that's a good point. So this is as good as the data that they get. So if the member is not showing their priority health card and they're going to the health department as an example, then those members are not accounted for in here. So there are members that will go to the health department and they're getting the vaccine or they're getting tested for free. And that's not counting against your guys's claim. So that's good news for you guys, but it's also not counting. It's not going to be in the counts we see here either.
It really,
Obviously, they go into the hospital, we're not getting around that very well. And that's where the bigger dollars are coming into play.
it really bugs me and bothers me, the tremendous amount of advertising, if you will, that we listen or down our throat. Oh, it's free, it's free, it's free, with the implication, from my interpretation, that either the feds or the state was picking that up, but they're not.
Yeah, no, it is. It's very frustrating. And I thought the same thing, because when we started getting these COVID reports, I mean, I was surprised last year when I was seeing some of these numbers that, this is not free. And the way they continue to push for tests, I mean, you can't even go to the doctors. I don't know about there, but here you can't even go to the doctors anymore with a regular cold or they're testing you instantly. So it is unfortunate because I think there are a lot of unnecessary tests that are being performed that is costing the employers money when we already have an issue with healthcare and rates. So it certainly does not help. And then two, we're getting, a lot of false positives as well. And what is that creating and causing on this too?
Anything else? Jennifer?
Yes.
Oh, I was just asking if anybody has any questions here.
Okay, yep. And just so you guys know too, further on in that report, you can see some of that vaccine information as well. So it looks like, again, from what's been reported, about 61% of the members are vaccinated and about 39 are not. Probably pretty skewed because I think there's a lot that's not reported here, but you can at least see those that have been vaccinated, which vaccine that they've gotten and so forth. And,
Yes.
and you can see there too, the cost. I mean, it's not free.
I didn't hear anything from the insurance companies who are ultimately paying the price and passing it on to the clients, their patients. I don't recall having heard anything, any voice from any insurance company, because they were picking up the bill, not the feds or the state.
Yeah, so we would have went through a similar report like this last year. I'll have to pull it and see. Unless Priority wasn't releasing them at that point, I'll have to pull it and see. I know Blues was. So I can look and see at last year's meeting information.
Because I would have expected, and I'm frequently wrong on what I expect, but that the insurance companies would have put out a statement that said, hey, people, if you're in an insurance company or with a health insurance company, they're picking up the bill. The or not. This is not a free service.
Yeah. That makes sense for sure to you and I, but that's unfortunately not what they're doing. I think instead they're pushing just as much for the testing, quite honestly.
Tells me the insurance company rolled over to the government and played like, oh, it's okay. We won't tell anybody that we're actually picking up on this.
You got to remember, Spectrum owns Priority Health too. So just keep that in mind.
I will, but it's still, it's wrong.
Yeah. Nope, I agree. I agree 100% for sure.
Okay,
Any
so
other questions?
in a couple of weeks, you have some other options you can bring to us in person and we can discuss at the workshop 10 a.m. on the 3rd of November.
You got it. Yep. So I'm going to check my calendar, make sure that works. I will get something over to Trina, just confirming that date with her. And then I'm going to continue to push to get these options back. And if I can get something together prior, even a week prior, I'll send it over in advance so that way you guys have time to look at it too. But just kind of try to keep you guys up to date as possible.
Very good. Any other
All right.
questions?
Sounds good.
Okay, well, thanks again for giving us the info, and we'll see you in a couple weeks.
All right. Sounds good. Have a good day.
I'm going to juggle a couple things here. I'm going to let finance court is basically we're working on 2022 budgets. Kind of wrap up 21. I will say we only planned on 5% increase for 22 on insurance, so it's going to require some new juggling there. But I'd like to slide the treasurer's report in here real quick, just so she doesn't have to come back after the closed session.
I have
If
a
that's okay.
request for a budget amendment for the delinquent tax revolving fund, with the change in the law, the way the presentation was. I was not anticipating the changes that I have for the tax sale. And so I need to make an amendment, and it's an increase of $82,000 to that fund. The monies that we received from the sale of the properties, we just closed out our last sale. We had no bids on it. So there is one that will be going in a different route for the tax sale. So the amount that we received was $79,650. And that balance is transferred out to the fund balance, which is going to be restricted for any claims that we have. So I needed to include that in the new budget, which is why the increase is the $82,000. And there was also more interest that we took in that I had not anticipated. So my overall change is an increase of $82,000 to the new bottom line of 166, and the details are on the spreadsheet behind. And what I would like, which is changing the bottom line, so I need that either a vote from you or some recommendations on how you'd like me to fix that.
I would move the requested amendment for Fund 254 with an increase of $82,000 for a new total of $166,000.
Second.
Motion by Brumman, second by Small. Any further discussion? Roll call, please.
Thompson,
Yes.
Small,
Yes.
Brady,
Yes.
Drummond.
Yes.
Thank you. Other than that, we are, like I said, the tax sale just completed. I have heard nothing on any movement for the rectification of the one property that I had discussed at the last meeting, where there was some issues with the sale that we had. Tom is just back and I haven't had an opportunity to talk to him, but I will get that taken care of. We're slow on collection of taxes for prior years. Starting to sell, the dog licenses went out, or the renewals. You got your cute little card. We have sold a few of those, and we're just kind of plugging along, working on the budgets and trying to clean up last year's. Does anyone have any questions for me?
So, thanks for everything, Cheryl.
Okay, thank you.
At this time, I recommend we just take a 5-minute recess and then we'll go into closed session.
Absolutely, thank you.
Have one page for you. Tina is cleaning up the rest of what this. I'll just look at it when I get some more copies.
The product used for vaccine. We have every ability to do which is mine. Or the storage, sharing.
Oh, yeah, but that's, you're lucky.
Everybody.
How long is the closed session for? Are we back?
It's true. You get the J&J, they're on a 5. The product.
Nothing. I think they're trying to get through everything right now.
It's still that.
I'm assuming this is they're going in, they have to do that, so they're gonna take the sales session.
Yeah, it's our tax dollars.
Yeah.
They're getting it back. Yeah, yeah.
And their committee reports, public comment, and their additional comments. So there's a bit left if you're.
So now is, I saw that Lisa and Dr.
They'll ask you for your insurance cards.
I was expecting them to talk.
But if you don't.
But I-
First, I'll maybe they might find a booster out of it.
We have their number.
Seriously, because I really don't know. I had.
I remember that was back in January, when it first came out, a lot of people changed it, and it was too, so.
Oh, they were on public comment. They were online, yeah, but and I expected something, but maybe they were waiting for the last one because they. It's 3 minutes on there. 5 minutes on here. That's what I asked.
So you're saying.
Yeah, we're out of here. I'm gonna,
How many?
it's gonna be.
Yeah.
Okay.
I'm, yeah, I'm assuming. Hey.
You gotta go get tested. Somebody.
Yeah, right.
That's
why that's really hard. The list is.
Right.
I told. Colonoscopy, and I get violated, I didn't know. Huh? Yeah, at least I didn't remember it, right? I knocked me out, I didn't remember it. I can have that before we go on cruises right now.
Which one is stuff?
Western Korean. Going to, one of our stops. Mojave Bay, Grand Canyon, Louise, and Cozumel. Yeah, there's 19 of us. We got one excursion, that's on Friday, which is the last port stop. In Cozumel, we're going up to the Aztec ruins. It's an 8-hour thing up into the Aztec. Yeah, it's gonna be really cool.
Wow.
Huh? Yeah, my kid's really into it because he was an archaeologist.
Yeah, do really a roll call
Brumman,
Here.
Small,
here.
Brady,
Here.
Thompson.
Here,
Right behind you.
behind you.
We're missing
Oh,
one.
there they are. I haven't seen-
Oh, I forgot my agenda. There it is on the other side. Okay, we're back out of closed. Next item. Let's see here. I guess we will. Got a couple motions to make from closed session. It's all making here. We got first motion to proceed with approved terms for negotiations with Union 214 as discussed.
Support.
Moved by Adam, supported by Bill. You said it first. Any further discussion? Hearing none, let's have a roll call.
Brumman,
Who did you say?
Brumman,
Oh, yes. Here.
Thompson,
Here.
Small,
Yes.
Brady.
You mean yes?
Yes.
Yes,
Here.
okay. Or no, I just want to clarify. Yes, Brady's yes. Motion carries. Next, motion, right. Motion to uphold decision made by Personnel Committee regarding grievance 2041 and authorize chair to sign grievance notification letter. I will make a motion to, sorry.
Support.
Moved by Brady, supported by Thompson. Any discussion? Hearing none, we'll have a roll call, please.
Small,
Yes.
Thompson,
Yes.
Brumman,
Yes.
Brady.
Yes. Okay, moving on, clerk's report.
I just have a couple of things. Terry, first of all, my question is, do you want me to take the Mitchell Township letter and the Curtis Township letter and just keep those in the communications for next meeting?
Yes.
Okay, the next thing I have, Mesa, Jim Baker has been reaching back out to us. They pretty much will have the insurance quote done. He's hoping to, he said by October 29th. He had just a couple of clarification questions. So I don't know, it almost is like him and Jen Martin will be here on the same day. It looks, I don't know for sure what's gonna happen there.
Ooh,
Or maybe
could
put
be a
him,
royal rumble.
maybe we put him at the next meeting, the second meeting in November
We don't have
instead.
time to wait. So if she does the morning, he comes in the afternoon, maybe that's the way to do it.
They're gonna both be quoting the same exact company too, so I mean, Blue Care Network sets their
Really
rates. but-
interesting.
Put them
Uh,
on one side. and-
because 2022, we gotta vote on that period. November, we already started taking too long, so.
Which I think most of Jennifer's stuff will be done in the morning. The other thing, we got a letter from the Department of Health and Human Services that child care fund budget that was submitted and you signed was approved. And I think they'll set the reimbursement and then notify the trial court for that. The other thing in your communications was the assessing officers report, and that's from, I believe that Mr. Alan Bird, that was the county assessor that you guys had
Okay.
nominated, appointed. And this is, it looks like an annual report that he has to have submitted by October 15th of each year online, and it looks like he was in compliance, so I'll put that in the new assessor file. And then there are,
I would ask that that be reflected in our minutes, that we received the report.
and then just some resolutions for other counties, and that's, I think, all I have.
That covers communications as well. So how about committee reports? Terry?
Veterans. We're gonna have a little discussion individually, reference it. We will be going forward, I'm sure. They're determined, we use the word determined to buy property and put a building on it. And that's where we're at right now, is working on the details, and they'll be bringing proposals to the board. Let's see, that's pretty. Oh, I will be attending a conference over in Traverse City on mental health. Next week.
Y'all go.
Big Bear Resort, we used to call it.
Did, where is this parcel that they're
The
looking.
parcel they're looking at is the one in Lincoln, right across from.
Oh, okay.
Cross from what?
Alcoa Motors.
It's a
The
flower
old
shop.
flower shop.
Oh,
Well, actually, I don't know if it's,
Or
to me, the flower shop is still there.
Oh, the vacant
the vacant
between,
lot.
oh, it used to be, Beast.
Yeah.
What the bar was there,
Oh,
what was that?
Twin.
Twin Lakes, yeah.
Lakes, yeah. Used to be- Oh, I know that name. I did look at the spec.
That's a nice lot.
That's the one they're looking at right now. And of course, it's owned by the
The city.
downtown development. apparently,
Oh, okay.
Is what I'm getting. So, anyway, I'm bringing you up to date.
Okay,
Yes, I can. Okay, that's all I got.
that's all you got? I don't have anything worth mentioning. What do you got, Bill?
Union, basically, and I did go to the Northern Michigan's association, county association. They had a presentation on peas for the contamination with Eagle. And that was a pretty good one overall. And then the MAC update was they're still working on finalizing a 4-year commissioner's terms in 2024, I think it is. They brought up that the final rules for the American Rescue is not there yet. It's still under pending. And they're talking a little bit about trying to, the state level wise, to have it's a trust fund create for the profit sharing money, so that it would always be budgeted over into this like line item, and so it would always be there, and then it would have to be, as the lady said, they could take it, but it'd have to go through a vote to mark it off again. It was sort of neat. They were more worried about a lot of them don't like Zoom, but we are going to do Zoom for next year. We're going to plan some kind of Camp Grayling tour in April. Go over and see them. So that's about it.
All right, Ken.
I'm sorry, I gotta laugh about this 4-year thing. It goes all the way back in the 80s. I remember voting on that subject. And they're still trying to get it.
Yeah.
I'm sorry.
no. There is one thing I'd like to do, or I would ask to somewhat deviate from, or before I do any of the rest of my stuff. I would like to make a motion to authorize the chair to, I'm gonna say the chair to create, but I'm doing so with the understanding that basically Scott would do it, would write it for you, but to go under your signature in opposition to the ability of a local hospital or local emergency room doctor to mandate where an ambulance can and cannot go. I think it's critical that we get our voice out there. I think that needs to get to our legislators. It needs to get to the entity that oversees. I realize it's a temporary person right now. It may become a permanent person. We don't know. But I think we need to indicate our voice on this. And for that reason, I will make a motion that will authorize the chair to send a communication to the appropriate state and regional individuals in opposition to whatever that's called.
The protocol.
Thank
We have
you.
a medical control board meeting later this month, I think the 27th or the 28th. Well, that's the first place it's gonna come up.
Yeah.
Okay, I see if, so
Thank you.
Scott's gonna provide some
I'll work
verbiage on
with
that.
Yep.
Thank you.
Where it goes. Who to
We'll
send it
figure that
to?
out.
29th, Scott.
It's the 29th.
Moved and seconded for
Wednesday.
the motion as suggested.
No,
underneath
29th
that.
is Friday.
Okay.
I did. Oh, I don't think
Goes
it's
well.
September. It was.
Any more discussion?
Okay, so what exactly? I guess I'd like to see something in writing.
Well, it's what he sent you.
The email that I sent you yesterday,
Okay.
there was 6 or 7 attachments.
Mhm,
The very last page, the
mhm.
very last attachment is the one where the MCA could adopt that protocol, where that emergency room physician has giving them the authority or the ability to call a 911 center or the ambulance service direct and order them, advise them, however you want to phrase it. You're taking a transfer out of this ER and you're going to this ER, this hospital, or that hospital.
Who's giving the authority to the emergency doctor to do that?
It's the MCA, the Medical
Yeah.
Control Authority. If they adopt that protocol, they don't have to, but if they choose to adopt it,
Mhm.
then that gives the ER physicians up in Alpena, mid-Michigan, to have that ability or have that authority.
And they would use it.
All right.
And
It's fearful to me, yes. Because it could cause us to not be able to respond to one of our own people when they're in need.
I realize that.
I know you do, but
I'm just
that's,
trying to figure out who is telling,
Yeah.
who is how now allowing such.
yeah, it's in the documents.
They-
Exactly, but I'd still like to hear it from
Okay.
somebody.
this protocol or this system kind of came up 2 years ago,
Mhm.
early on in the COVID stages.
Okay.
The Michigan Firefighters Association and a couple other big organizations fought it and said, look, you're going to deplete all of our 911 resources.
Yeah.
Especially in the rural area.
So they haven't tried to do this under any emergency type,
No,
it's just strictly.
but the protocol's been developed by the state. It's in
Mhm.
draft form.
Mhm.
The MCA could approve said protocol.
Mm.
And then that's going to give those ER physicians, I don't want to use the words carte blanche, but it's going to turn into a battle.
Mm.
If they start mandating, and there's 5 services, 5 ambulance services in the MCA. And they could pick any one of the 5 they want based on need or who will answer the phone or who will or won't show up.
Okay.
Any others discussion? All right, all those in favor?
I
All those opposed? Motion carries.
thank you all. In addition to that, 211, fairly routine, although we just authorized and signed in on a navigational grant, which will allow us to do the training and be able to help guide people for both Medicare and Medicaid. Grant it puts our budget over $1 million, and the grant is like 300,000. I can't remember that, but it's a large grant, but we decided it was worth it. Done a little bit of work on union stuff.
Yeah.
Did bills for 211, reviewed some property considerations, procedure like improvement board, CLID, attended by 2 township board meetings, but that's not part of what we to do. And I think I did some other things, but I don't remember what, and it was not earth shaking, whatever it was. That's it.
Okay, thanks, everybody. Public comment, 5 minutes. Identify yourself and where you're from.
I think you upheld Personnel Committee's recommendation, so they walked out. Who's going to draft the letter or draft the written response to them?
We'll get that out by Friday.
We have that. Oh, I see.
According to the contract, you gotta give them written notification as to your decision.
Personnel is going to draft a letter. I will
With
sign it.
his help, yeah.
Okay, and all I can say is thank you.
You're like me, not any easier right now.
Okay.
Nobody online and nobody left over here, so public comments off the docket. Any additional comments by commissioners today?
Long meeting.
That's
right. Sign means he's got something. Let's hear it.
Yeah. Well, let's not talk about it today, but it's gonna come up.
Give us a topic.
The belt money. It's gonna be
Oh.
coming,
Oh, yeah. Okay.
it's gonna be coming up. We've got.
Well,
requests from
yeah,
the
we got it. It's,
I mean,
Like, you guys need to refresh me when it does come up about, as you were indicating, because at this point, I'm sort of going, well, gee, why are we keeping it? And yeah, tell me more about
I
it.
would like to answer that question too. Why are we keeping it?
You want to crack that egg right now?
No,
Okay. 'Cause I can, but I'm,
We'll hold it. We'll hold it for another.
I think, I'll ask that already that, that comes under new business. Under, for our next meeting, under agenda, request that. And, we can have a good discussion then.
Okay, cool. Because I'm getting hit on those two.
You're getting put on that one?
Well, my townships are, even though they don't get much. they
I was
pay.
gonna say, you have something, you
Well,
actually have a township that has fed that money?
Harrisville, if they get anything at the buck, the point is they feel that it's good faith if you participate back, if you give money back to the townships, then it shows that you're just good faith. I mean, it's a long.
I like your thought there, Bill.
Yeah, well, it's.
He didn't say
It's
it was
good for
his
another
thought.
discussion. We'll hold it for another.
Yeah, yeah. Did you want to adjourn?
let's adjourn.
Second.